The 11 o'clock hour now with news from medicine's cutting edge, and women have to confront a flood of information on breast cancer that comes from the scientific and medical communities, and to some it almost seems to change regularly. Whether the news is about cause, potential risks, or the technology to find and treat breast cancer early, information overload can make it complicated. Dr. Peter Dunner is a radiologist at the Washington Radiology Associates, and he joins us this morning to try and help make some sense and to put some perspective on what women ought to be paying attention to and maybe some of the things that aren't as important as sometimes gets the publicity. Doctor, thank you for joining us, first of all.
Thank you.
It is as simple sometimes as starting, and you start with that regular exam.
Correct. The gateway to good breast care would begin with a visit to either a general practitioner, an OBGYN for a breast examination. What's extremely important is the family history, because there are many women out there who are at a higher risk, women whose families have had breast cancer, a first-degree relative who have had the BRCA gene, which you probably have heard about in the news. And this family history will direct what needs to be done and when to begin.
At what age should those regular exams start?
The regular exams should begin at approximately 30 as a routine gynecologic procedure, but annually after 40, and if the family history is stronger, annually much earlier than that.
It's important that you get into this sort of regular professional exam, but there are other regular exams that women ought to be doing, the breast self-exams, right?
Absolutely. That has come under some controversy recently, but from anecdotal information that I could share with you, I have found that many, many women discover lumps themselves. I don't see any particular downside at all to doing a breast self-examination if the woman feels comfortable.
And we also want to take advantage of the very best technology, and when that comes to scans, you start with a digital mammography exam, right?
Correct. That's the golden standard, and that's really the basis for all breast workup at this point.
And again, the key word there is digital mammography. At what age does that start?
In a patient who has no high risk, the baseline is about 35, and then annually after 40. But this can be pushed up several years depending on the family history.
There is some concern about getting those mammography scans and false positives and things like that. How do you ensure that you're going to a place that practices that gold standard of radiology?
Well, the FDA has highly regulated mammography, and there's a Mammography Quality Standards Act that every good institution has to adhere to. And the first thing you should ask is if the facility is accredited.
Women tend to panic if they are called back. I know this. My wife had that happen to her a couple of months ago. And it's important to know that just because you're called back doesn't mean that anything's wrong, does it?
That's absolutely correct. The breast is a three-dimensional movable structure, and it's impossible to position exactly the same from year to year, and there are a certain number of cases where we have a question that needs to be answered. So I always tell my patients that they should be afraid of not finding out things than finding out things.
It's much worse not to know.
Absolutely.
And sort of an overarching thing here, you're the important person in this whole thing, and you need to ask questions, right?
Correct. We have to take a complete history of the patient and find out things like whether there are any positive BRCA genes, phase of the menstrual cycle, and it helps us interpret the studies. Very important
and straightforward look at the things that you need to know about breast health reminders. Dr. Peter Dunner is a radiologist at the Washington Radiology Associates, and we really appreciate your joining us.
Thank you for having me.
Thank you so much. We'll step away from